Sports injuries, assignment 2. The inflammatory response is caused by the release of chemicals in a damaged area. This response can last between 10 minutes to 7 days and is achieved by the dilation of blood vessels. This causes swelling, localized redness, increase in temperature, loss of function, and pain in the area of the damaged tissue. An example of an injury that might go through the inflammatory response is a sprained ankle, where you would expect to see a lack of range of motion and pain to prevent the athlete damaging it further. Inflammation is when the blood goes through the injured parts and it helps to lead the process of recovery. It changes for each injury, as for example, a sprained ankle, you might see more bruising and swelling compared to a pulled hamstring, which is less severe and only has minor swelling. But you would expect to feel feelings of muscle tightness. Without this stage reducing range of motion and producing pain, athletes may play on with the injury, causing further and possibly even permanent damage. This could prevent athletes from participating in the sport in the future. The next phase is the repair phase. This is the phase where the body starts to repair itself. During this phase, you would expect to see increased collagen fibers in an injured area, which leads to scar tissue. This is negative as it is less pliable and strong, and not as strong as regular tissue. However, it is good because it helps the injury to start healing again. This stage normally occurs in the 7 to 21 day mark after injury. Normally this phase would last 2 to 4 weeks, where it depends on the size and site of injury. For example, a tendon, such as the Achilles, may take longer than muscles to repair due to a poor blood flow. The last phase is the remodeling phase. This is the longest phase in the healing process. This phase is about having a gradual increase in strength to rebuild the body back to doing normal exercise again. The whole stage can last from 6 to 18 months depending on the injury. For example, similar to repair, ligaments have poor blood flow, so they take longer to repair than the muscles. That's why when people tear their ACLs, they're recommended to not play sport for 18 months. Fibre arrangement in previous phase becomes more organised, which means tissues can become stronger and more robust again. Other consequences of this means that skin will eventually change back to its original colour. The sensitivity in the area of the injury is reduced, and you would expect to see a reduction in swelling. An example of a player that tore his ACL is Klay Thompson, who only tore it a few months ago and has been advised not to play sport for another 18 months to allow for the best heal, to allow the ACL heal the best, to prevent further chance of reoccurring injury. If a player does come back early, there may be a subconscious worry in the back of his mind about possibly re-injuring himself, which may lead to a decrease in performance. Furthermore, it also means the knee isn't as strong as previously, which could also impact on performance. For example, his speed might not be as quick, or his jump. For example, for Klay Thompson, this would impact his finishing around the rim, as he wouldn't be able to get open as easily as he could have done before. The next physiological change in the body in response to injury I'm covering is coagulation. This is when the blood clots. It is a process of the blood changing from a liquid to a solid, and it occurs right after an injury happens. The whole process of clotting and stopping bleeding is called hemostasis. This procedure prevents blood vessels from losing too much blood. Coagulation is a massive part of this. When damage is caused in the endothelium, which is the lining of the blood vessel wall, platelets, which are disc-shaped blood cells, which are produced in the bone marrow, blood to plug up the open wound. If you have been diagnosed with haemophilia, this is something your body struggles to do. This may be because your body does not have enough platelets. While the plug is being formed, proteins in the plasma respond to fibrin strands. Fibrin is an insoluble protein made via three stages. These stages are the formation of prothrombinase, which is when liquid blood comes into contact with foreign objects or molecules, which then stimulates the production. And then prothrombin is converted to thrombin, which is another enzyme. And then fibrinogen is converted into fibrin by thrombin, which forms thread-like scaffolding structures that form and help the platelets clot the wound. This process of making fibrin is stimulated when a series of chemical changes take place in the body while platelets are plugging the open wound. Fibrin's job is to collect around a wound in a mesh-like structure to strengthen the platelets and allow coagulation to occur. It is really important to have this function, as preventing excessive bleeding is massively important, as otherwise it can be dangerous, especially if the blood enters other tissues. This is known as a hematoma, and it can cause serious damage if not clotted in time. Those who have blood that cannot clot are called hemophiliacs. Up until recently, many hemophiliacs wouldn't be able to play sport at all, whether it was contact or non-contact. Nowadays, for some, medicine and knowledge has made it possible. For example, a player I have researched, and the reference will be in my script, suffered from moderate haemophilia, which is when you only have 1 to 5% of normal clotting factors in your body. He had a schedule every week where he would inject himself on a Monday, a Wednesday and a Friday with factor 8, which helps with blood clotting. And he would also inject himself pre-game, so somewhere around about 1 to 2 hours before. This athlete managed to play his entire 2 years at college in America with only a few minor injuries, which the protocol they set up took care of, and he experienced no side effects of haemophilia. The next physiological response to injury I'm talking about is scar tissue. This is a type of tissue that forms at a weak or an injured site in the body. If too big a load is applied too early, or the load is too heavy for the area, injury is likely to reoccur. According to Hoogland 2005, newly formed scar tissue has more elasticity than more mature scar tissue. This may be because a serious injury could have occurred, meaning that the scar tissue doesn't dissolve or fade. Furthermore, old scar tissue may have not aligned properly like it should have done. It is important for scar tissue to introduce early mobility and to help fibre alignment and range of motion, but introducing too much of a load too early, as mentioned previously, can lead to injury. Scar tissue also increases the risk of injury. As mentioned before, it's not as pliable as normal muscular tissue, and therefore decreases the range of motion a particular muscle group has. Scar tissue forms in an irregular pattern, but the body needs it to be in parallel lines to produce strength. Although scar tissue is not as efficient and pliable as skin and muscular tissue, it is important to help the body repair damaged tissues. Each response here I've covered is different for each injury. For example, torn ligaments and tendons, as mentioned previously, take a lot longer to repair compared to bone and muscles, which in some circumstances only take 12 weeks. As mentioned previously, this is about the blood supply available and the severity of the condition. There are also many psychological changes in response to injury. For example, the body can react in numerous ways to injury initially. For example, athletes may be angry and ask themselves, why me? They also may be anxious and wonder whether they will ever recover from this particular injury. This is important to athletes because it is a job for them and it's their way of making money. So if their income is gone, especially for athletes that don't earn as much as others, it could cause some financial trouble for them. Additionally, they may feel depressed as exercise releases endorphins in the brain, which makes you feel good. So not playing can lead to depression as it is almost like a withdrawal symptom. Athletes may also feel frustrated as they could be bored of rehabbing and miss playing the sport. Furthermore, they could be frustrated by the long timescales of waiting to run and walk. Furthermore, people in football usually come back from concussion early as it is not taken seriously as it is in rugby. This can have some long-term effects that we do not know about yet due to the limited research. So it is important for all injuries we take our time and don't come back too early as it can cause serious damage, especially later on in life. The ways we can deal with these psychological changes is maintaining group cohesion by involving the injured person in social activities or even just during training, as isolation can be a big problem for players. This can help to reduce stress and anxiety. Athletes might also experience psychological changes during or post-injury. One of these could be fear, and they could be worried about re-injuring themselves and having to complete the whole process of rehab again. An example of this is Derrick Rose, who plays in the NBA. The Detroit Pistons player has suffered many injuries in his playing career and has never been quite the same compared to prior to his injuries. These include torn ACLs as well as 17 other injuries, resulting in 237 missed games, which is 2.5 seasons of basketball by 2016. I believe there are two reasons for his decreased performance. One is because his body is no longer in the physical condition it was before, and due to the injuries, it has got weaker and weaker. However, I think the biggest factor is Derrick Rose's mentality, as I think he fears re-injuring himself again and having to retire from the game of basketball to possibly increase his quality of life in years to come. An example of something that could cause him pain and grief later on in life is arthritis. This could have a big effect mentally, as obviously the athlete it doesn't feel too bad at the time, but can cause him significant damage later on in life. Another psychological response is frustration. This could be annoying to the athlete as they might have to miss key games such as cup finals, and they might find that their timetable to return keeps getting pushed back. They could also suffer a drop in motivation as they may not see the light at the end of the tunnel. It is important that teammates and the physio boost the morale of the player, and this can also be helped by goal setting. This boosts motivation as instead of reaching for the end goal, which is getting back to playing fully, goal setting breaks it down into smaller and more realistic goals, such as walking after a certain period of time or running after 3 months, for example. This keeps the athlete focused on the next steps without falling into the trap of thinking about the bigger picture. All of these psychological effects on injuries were all experienced by a basketball player called Devin Van Oostrum, who has played for the Great Britain national team. This is because within the space of 2 years, Devin tore his ACL twice. The GB international would have been extremely frustrated after the first time, but definitely more so after the second, as he knew that he would have to complete the whole process again. Additionally, thoughts about ever playing basketball again, healthy, would be louder than previously before in the back of his mind. However, Devin stuck to the process of goal setting and stayed motivated through his tough times and down days to get back to where he needed to be from a basketball standpoint. This would have helped him complete his rehab to a better standard, which in the long run was positive, as we know early mobility and stretching can help the remodelling process. It is important that for all athletes they are kept motivated and focused on coming back just as strong as they were before. This can be done in numerous ways. One could be goal setting, as I just mentioned. Ideally, athletes should be setting themselves goals on at least a weekly basis to work on the smaller steps of getting back to the bigger picture, whether that is achieving more range of movement in the leg or walking a bit further than they did the day before. This means that the athlete is always occupied, and it helps them not to relapse into frustration and anger, which could significantly impact their motivation, and therefore how quick they get back to playing again. Additionally, with each goal they achieve, they feel good about themselves, as similar hormones are released in the brain to doing exercise, which is beneficial. Physiotherapists should also keep notes on all the goals achieved to show the athlete on his down days how far he has come, as well as giving him positive feedback to keep him progressing with his rehabilitation. Other ways physiotherapists can keep the athlete interested and motivated in his rehab is to try and integrate the player into basketball-related activities as soon as possible. This could be shooting from sitting down on a chair, or doing passing drills, standing up, or shooting free throws. Although the athlete is not fully competing, they would get a sense of satisfaction of being able to do some form of basketball, as for a lot of players, it is also a love and a passion. The athlete could also watch practice and help to give out pointers and advice to players to make themselves feel more involved in maintaining that social cohesion factor, which would reduce the chance of the athlete feeling isolated. Furthermore, with the help of a psychologist, the athlete can use imagery to almost practice and play basketball whilst injured. This technique is good to use during the whole process, but especially during the latter ends of rehabilitation. I think this because it helps the athlete gain confidence in themselves before they train for the first time, as the process is so realistic and in detail, the athlete would feel like they've trained for weeks already. Additionally, imagery has been proven to use the same neuromuscular pathways that you would use when you actually play the sport. For example, if you imagine you shooting the basketball, the neuromuscular pathways in your arm work exactly the same way as if you are actually shooting. This means that the athlete could almost practice skills such as shooting and dribbling before they even get back on the court.